While baldness is usually known to take place in the later stages of life, this can be found in earlier generations with alopecia areata. Alopecia is a disease that usually starts with the appearance of one or more circular bald patches that may overlap, coupled with rapid hair loss after onset. Symptoms include hair loss in unusual blotchy patterns, pain, itching, and red, scaly, abnormal patches of the affected area of skin. It can be caused by multiple reasons: experience of high fever or severe infection, childbirth, major surgery, blood loss, or illness. Many alopecia patients also point to severe emotional stress as one of the reasons. Alopecia could be equally found among all races and gender. While it can happen to any toddler or grandfather, alopecia usually occurs during early teens to 30s. This disease affects about 1 in every 500 to 1,000 people in the US, and it's surprisingly common. About 2% of the world's population will experience it sometime in their lives. But don't fear, since the prognosis of alopecia isn't as grave as it may seem. Within 1 year, about 50% of patients tend to experience spontaneous hair regrowth without treatment. Patients are usually healthy, and having this disease does not lower life expectancy. But for the remaining 50%, treatment is always an option through various forms: injection or application of steroids such as Dermavate, wigs, and hair transplant procedures. Alright, now we move on to the confusing part of the video, talking a little about the signal transduction pathways associated with alopecia, but we'll try to break it down for you. So normally, hair growth occurs through a specific pathway called the JAK-STAT pathway. Ligands bind to receptors on the cell surface, inducing dimerization of receptor-associated JAKs, which then activate the JAK-STAT pathway. Receptor-associated JAKs then bind to ATP and become active, continuing the signaling cascade. STAT transcription factors that are activated lead to translocation within the nucleus, where they regulate gene transcription involved in maintaining internal and adaptive immunity, also along with the production of pro-inflammatory cytokines. But these cytokines are where the problem starts. There are two main types of cytokines, IL-15 and IFN-gamma. Basically, IL-15, which is secreted by follicular epithelial cells, leads to activation of cytotoxic T cells, which in turn secrete IFN-gamma. Then this IFN-gamma binds back to the follicular epithelial cells and leads to even more production of IL-15. And then the IL-15 leads to activation of cytotoxic T cells, and yeah, you can see where this is going. This positive feedback loop causes an overactive JAK-STAT pathway, which is suspected to cause all this problematic inflammation and hair loss situation. Researchers are hard at work to try and fix this issue. What they're trying to understand is why exactly the immune system is attacking healthy hair follicles when they really have no reason to. Not only that, but studies are being done on potential treatments of alopecia. Researchers at Yale are experimenting with the arthritis drug baricitinib and its effects on patients, where they found that 1 in 3 patients with severe alopecia had regrown hair with this treatment. There are also clinical trials conducted by Aslan Pharmaceuticals to investigate effectiveness of farudostat in adults with alopecia when orally administered. There's also research being done on relationships between anxiety and alopecia patients, as 51% of pediatric alopecia patients meet criteria for anxiety disorders, and this may give us some major clues on the reasons behind occurrences of alopecia. Last thing, let's talk JAK inhibitors, the types of drugs that are most likely to treat alopecia, and how exactly this affects the pathways in a good way. These inhibitors basically prevent phosphorylation of key proteins involved in signal transduction that leads to immune activation and inflammation. This means that IL-15 and other pro-inflammatory cytokines are stopped right in their tracks as they go on their way to wreak havoc on someone's immune system. Thanks for listening.